Good evening, ladies and gentlemen. I am Kayode. I'll be discussing with you on the topic drug in, out, and around the body. Thank you for having me. What is a drug? The goal of any drug therapy is either to prevent, cure, or control a disease state. Therefore, we can define a drug as any substance that you take to prevent, treat, or manage a disease state. Anything you take to improve your health. So, for us to achieve this goal of drug therapy, we must deliver the adequate dose to the affected tissue such that a non-toxic dose will not be delivered to such vessel. Routes of administration. There are various routes by which drugs are administered as they get into the body. The commonest of them rather, is the oral route, which is through the mouth. We have drugs that are administered through injections, IV or IM. We have drugs that we administer through the skin, the topical application, through inhalation, for example, asthmatic drug, and through the rectum or vagina in the form of suppositories and pastries. What happens when a drug enters the body? When a drug enters the body, four things happen essentially. The first of them is absorption. The absorption is the transfer of drug from the site of administration to the bloodstream. The next is distribution, which is drug around the body. The next is distribution. Distribution is the process by which a particular drug molecule moves reversibly between leaves and come into the blood, move reversibly between the bloodstream and the cells and the tissue, and through the extracellular fluid also. The next is the metabolism, which is the breakdown of a drug into the biotransformation or breakdown of a drug into an excretable metabolite. In this case, what essentially happens is a non-polar drug is converted to a polar metabolite for easy removal from the body. Excretion is this is the removal of drug from the body through the urine via the kidney. And the most common of the route of excretion is the kidney, which brings the drug into urine, whereby we can take them out. Other routes include the bile, the intestine, lung, and the mother's milk. Why is it important to consider this topic? It is important because it will help us to give the right dose. Overdose and toxicity will be prevented. Drug interaction or drug food interaction can also be prevented. In conclusion, drugs are helpful when used correctly, but are harmful and poisonous when you misuse them. Knowing how drugs enter or leave the body empowers us to make safer health decisions. Therefore, my advice, let us use medicine wisely for a healthier community. Thank you for listening. God bless you.